with you the topic urinary tract infection, presented by Jenisha, lecturer of Emmanuel Ersel College of Pharmacy. Initially, the drug used as urinary antiseptics are nitrofurantoin, methenamine, nalidixic acid. First, nitroflurantoin. Primary bacteriostatic, actively limited to E. coli. The mechanism of action: sensitive bacteria reduces the drug to an active agent that inhibit various enzymes, damage bacterial DNA. Antibacterial concentration is not attained in blood or tissues. Not to be used with azootemic patient, interferes with tubular secretion of drug. Then adverse effect: gastrointestinal intolerance, nausea, epigastric pain, diarrhea, hypersensitivity, fever, chills, peripheral neurotitis and other neuronal effect with long-term use, hematologic disorder, hematic anemia in G6PD deficient patients, liver damage, pulmonary reaction with fibrosis on chronic use, contraindication in renal impairment, pregnancy and neonates. Then uses: treatment for uncomplicated lower urinary tract infection not associated with prostatitis, supportive long-term therapy, long-term prophylaxis following instrumentation in women with recurrent cysts. Methenamine. It's also called as hexamine. It's the prodrug and its mechanism of action is decomposes slowly in acidic urine to release formaldehyde, which inhibits all bacteria. No antimicrobial activity in blood and tissues. Need to be administered with mandolinic acid. Then uses: as methenamide mandolate in chronic and resistant UTI not involving kidney. Not effective for acute UTI catheter prophylaxis. And its side effect: gastritis, chemical cysts, occasional CNS symptom. Nalidixic acid. Non-fluorinate quinoline bacteria used to kill the bacteria. Mechanism of action: inhibit the replication of bacteria by interference with the action of DNA gyrase during bacterial growth and development. Resistance develops rather rapidly. Then uses: second-line drug for urinary tract infection, recurrent cases on the basis of sensitive reports. Adverse drug reaction: headache, drowsiness, GI upset, rashes, vertigo, visual disturbance, seizure in children, nausea, vomiting and abdominal pain, photosensitivity and uricosuriia and fever. Phenazopyridine. Urinary analgesic, affords symptomatic relief from burning, micturition, dysuria, urgency. No antibacterial property. Side effect: nausea, epigastric pain. Urinary tract infection treatment such as mostly gram-negative organisms cause this is UTA. Acute episode: single organism, chronic mixed infection. Acute infection largely self-limiting. High urine flow rate, frequent bladder voiding, single dose antibiotic for 3 days, course suffice. Upper UTI, longer treatment. Bacterial investigation very important. Smaller than usual dose required for the treatment of lower UTA. Upper UTA requires normal doses as for any other infection. Less toxic and cheaper drugs should be chosen for proper duration. Drugs should not disturb, not get and perennial flora. Frequent recursion, chronic suppressive treatment with nitrofurantoin, methenamine, cephalexin, norfloxacin. Status of antimicrobial agents other than UTI antiseptics. Sulfonamide decreased as dependency for acute UTA. Not used as single drug employed for suppressive or prophylactic therapy. Cortimazole declined responsiveness employed umbilical for acute UTA. Prophylaxis for recurrent cysts in women catheterized patients. Quinolines first generation non-fluoxetine and ciprofloxacin. Amoxicillin frequently used in past, higher failure and relapse rate unreliable for empirical. Amoxicillin plus clavulanic acid is used for mixed medicine as well as the antibiotic. Then cephalosporin. Cephalosporin increases the especially in nosocomial species and proteus infection. Employed on the basis of sensitivity report, employed for community acute infection as well. Cephalosporin alternate for prophylaxis of recurrent UTA, especially women with likely to get pregnant. Gentamicin sensitive against such Pseudomonas bacteria. Non-margin of safety. Parenteral administration. Bacterial sensitivity awaited. Urinary pH and antimicrobial agent. Acidic urine required for methenamide. Inadequate response in complicated cases. Measurement and correction of urinary pH and the attempted. Favorable urinary pH for antimicrobial action and acidic, alkaline, pH immaterial, nitrofurantoin, methenamine, cloxacin, cortimazole, aminoglycosides, cephalosporin, chloramphenicol, ampicillin. Urinary tract infection for acute regimen, all given orally for 3 to 5 days. Norfloxacin, ciprofloxacin, ofloxacin, cortimoxazole, cephalexin, ampicillin and clavulanic acid. Nitrofurantoin 50 mg 8 hours or 100 mg 12 hours into 5 to 7 days. Urinary infection in patient with renal impairment. Drug to treat drugs contraindicated methamphetamine, malolate, tetracycline, cephalosporin. Drugs avoided for nitrofurantoin, nalidixic acid, aminoglycosides. Potassium salt and acidifying agents are constructed or the contraindicated for UTI. Thank you.